Hi, it's Dr. Ruth, the Pain Doc, founder of Chronic Pain Rescue. I am so delighted today to bring in our very special guest. I'm just so impressed with this young woman. I want to just share her bio before I bring her on. She's Dr. Janice Brown, and it's so funny. She's got so much above me, but also very similar to me, and I give her all props. Um, we're in the same space. It kind of reminds me of when I took he's now a grown man, but when he was 6, Halloween, he was Superman. And he saw another little boy in the same exact costume, a Superman, and it was so great. They hugged each other, didn't know each other from Adam, but they were so excited to see someone else, another Superman. And I feel like I have a similar thing. There are 7.8 billion people in the earth. We can't. Neither one of us could possibly treat everyone. So it's great when there's other people out doing similar things to what you're doing and trying to make a positive impact in the world. Just going to read Dr. Brown's bio, then you're going to see her and I'm going to introduce her. This is what she wrote. I knew from an early age I wanted to be a doctor. My path to medical school was the road less traveled, having taken 6 years off between undergraduate and medical school. After I earned an undergraduate degree in Spanish at Columbia University, I pursued massage therapy at the former Swedish Institute in New York City. My fluency in Spanish led to my first job out of college as a research assistant at Columbia University Medical Center. All the while, I practiced massage therapy, learning various tools that would later serve me. In 2004, I started my medical training at New Jersey Medical School in Newark, New Jersey, where I applied for residency in physical medicine and rehabilitation. It was the one specialty that allowed me to see patients get better and back on their feet. However, since my passion has always been to guide people to better health and a better quality of life, I knew that I needed more than what Western medicine could offer. I pursued a board certification in medical acupuncture in 2011 and have since incorporated acupuncture in my practice. After about 10 years as an attending physician, I had an aha moment. I recognized that it was people's thoughts and belief systems that were holding them back from achieving better health. They were contributing to their ongoing symptoms of dis-ease. Down the rabbit hole of life coaching I went and never looked back. Today, I blend all my knowledge and skills into life coaching where people are guaranteed the results they're looking forward. Now, introducing Dr. Janice Brown. Bring her on to the stage. Welcome.
Hi, hello. Thank you for that. I didn't expect you to read all of that.
I really don't usually, but you are doing things that I admire. I feel like I'm beyond doing, extensive years long programs. So I'm not
Yeah,
going the functional medicine way, but I admire those that did. So
yeah, it is. I failed to add that I did get certified in functional medicine via the Institute for Functional Medicine, IFM.
right,
So that was another crazy thing that I
right,
did.
right. I'm sorry, I read the wrong one because you did send
That's
me that
okay.
update.
No,
I
no
did you
worries.
did send me that update. So I have a couple questions for you. First
Mhm,
off,
mhm.
before we even get into the functional medicine part, why health coaching? Because what is the difference as a health coach that you can bring to help a person versus being their doctor?
So one of the things that I find, and you know, that in the training for medicine, when we go through our residency, we're focused on fixing the problem at hand and dealing with symptoms. We seldom, I don't think we were trained on how to get to the root cause of any kind of issue that people come to us for.
Mhm.
And being in the field of physical medicine and rehab, we're oftentimes labeled as the pain doctors. And so people are going to come to us with all kinds of different pain, but we have to try to get down to the cause of it. And so what life coaching, health coaching does is that it actually explores more goes down to detail, kind of gather the information about how this person functioned prior to them, getting into pain, and try to understand their path, and then also addresses, for me, at least I do it, some of the psycho-emotional aspect of pain, because pain isn't by itself just something physical, right?
Right.
Somebody has an injury, they heal. They typically will heal, the body will heal. But why is it that person continues to experience pain while somebody else with the same injury doesn't? And
Right.
so that's where the nuance comes in. And so I delve into the psychosocial aspect of things. And that's kind of where the coaching comes in, because, you ask deeper questions, trying to get to the root cause.
Okay. Very good. And then, what is functional medicine? I know there are a lot of people that have probably never even heard of it, or if they've heard of it, it's just words. What is functional medicine? I know it's pretty extensive, but how would you explain it to people?
The best way to explain it, it's a form of medicine. It's a way to looking at the root cause. That's what it is. And some people may even go as far as saying that it's basically healing with food. So using what we eat, natural supplements, lifestyle changes to create change, or at least to create health in the body. So again, kind of like juxtaposing it with, modern medicine. Modern medicine is very good for dealing with acute issues. When I say acute for the audience, that means, hey, if you're having a heart attack, right, you're not going to say, oh, let me take some turmeric and try to decrease inflammation, or let me take, some herbs that, my works for helping with heart disease. No, you're not going to do that. You're going to go straight to the ER, and you're going to go get that heart catheterization, and you're going to find out if you have any blockage in your arteries and get those opened up. Okay. So what functional medicine, again, is going back to the root cause and using a more holistic approach to deal with your issues, meaning, again, lifestyle. And that includes exercise, stress management, food. Because if you think about food, it's the one, I would say now, probably the one thing that we have major control over. It's the one thing that we put in our bodies and we have control, absolute control over.
Okay.
So,
okay.
yeah.
Unless the food's controlling you.
I help people to lose weight too.
Oh, right. And that can be very important with weight optimization for back and knee pain and things like that. Sure. There's some areas of functional medicine, though, that I don't know if it applies to with chronic pain. Maybe not. Maybe it's just with autoimmune stuff, maybe. But I know I had been in a lecture one time. Honestly, I felt like a kindergartner sitting in a college class. So it was really over my head. A lot of things with genetics and looking. Do you have any use for that in your practice? Do you apply finding out people's genetics to help them?
I currently don't, but I understand the concepts behind it. Just because to get the testing, a lot of times the main barrier is like insurance won't pay for it. It's an out-of-pocket cost. But yes, there is a role for that. Some of the things that people may have heard is like the NTFR gene mutation. So basically how you process methyl groups in your body. That's just one example. But then there's all these different genetic modifications that you may have been born with versus ones that are created from lifestyle habits. So yes, there's a role for it. I just don't currently in my practice, I don't do much of it.
Right.
Again, because of, the cost. And, for those people who do want to do genetic testing, I use a lot of the functional medicine labs that are out there. There's a couple of big ones out there, and I will use them to get some testing done.
And when would you, I'm changing another question, but when would you decide to do toxology screening? Like if people have heavy metal poisoning or whatever, is that only specific to knowing there were certain symptoms, or is that something you do on, a screening? How do you decide to do those kind of things?
I've done quite a few of those in my practice, and mainly when somebody comes in with symptoms that cannot be explained by a physical finding. Like, so for instance, neuropathy is a really good one. If somebody comes in and they have very severe advancing neuropathy to the point that they may be immobile or wheelchair bound, and I can't find anything, perhaps in the spine or in the peripheral nerves, nerve conduction study, EMG, MRIs, doesn't really show anything, then I probably would go down that route. But again, I'm asking questions about, okay, where were they raised? What were they were exposed to? Because, people who may have been raised or brought up in mining towns, they were close to, places where the ground, they dug up stuff from the ground and, was exposed to those metals or whatever that was in the earth that probably shouldn't have been exposed to. I mean, those people I would want to do testing on. So yeah, I actually ordered one today for one of my patients in clinic, and that was a different scenario. But she's, for example, like in her case, she had some unexplained symptoms that she was concerned about, and didn't make any sense because everything came back negative. At least the imaging came back negative. So yeah, it's definitely. I definitely think about it depending on where they were raised and which parts of the world and what they were exposed to.
Okay. So my question too, who is your ideal patient? Who is your ideal client that you would love to help?
Anyone who is fed up with not feeling well.
Okay.
That they want to feel better, and they've tried a lot of things. And I feel as though, like, Pimanar, I'm sure you can relate to this, but we always get the patients that nobody knows what to do with them.
Exactly. The ones that they've tried everything and nothing's working, so we get them. Yes, I know.
Exactly. So maybe because of my training, and that's what I've been exposed to, I suppose. But I like these patients. I mean, they have to be patient, though. That's the thing. They have to be patient, and they have to be willing to do the work, because it's not going to be just like, oh, let me just give you something that's going to cure it. Right. I do a deep dive and look at what they're eating, how they're exercising, how they're sleeping, how they're managing stress, what they're thinking, because we now are showing more and more as the data comes out that, your thoughts influence heavily your outcomes, right? How you're thinking, how, the things that you're telling yourself create emotions, and these emotions are gonna, because sometimes people just embed their emotions internally, they internalize it, and it shows up, in other organ systems, whether it's in the muscle, the nerves, cardiovascular system, anywhere that you could possibly think of. It's what they call somatization, right? So those, I deal with all of that because I do believe that a lot of times when people have no further answers and they're stuck,
right,
this is where we need to head. We need to address the other things that no one really talks about.
Okay, very good. And they could be, are you, well, I know you do not only the coaching, but you also you're in the state of Georgia, correct?
No, I'm in Florida.
Oh, I keep messing that up. You're in Florida. Where in Florida again?
Central Florida, in a small town. I don't know if it's small anymore, but Ocala.
And you see people in person as well, right? So as a medical doctor, you see them. Yes. And you also do health coaching, which isn't restricted to Florida. You can see.
Yeah, I can see anybody
from anywhere. Okay. And if people wanted to see you in your office, if they're in Florida, what would they do? How would they contact you?
The best way to contact me is just to call the clinic, and you can just schedule an appointment.
Okay.
A lot of times. No, I was going to say, a lot of times, depending on the insurance, as we know, referrals are sometimes necessary in order to get the patient, and depending on the insurance.
Oh, okay. So you do accept insurance?
Yeah, we do. Yeah, the clinic that I work at is like um, it's your classic kind of medical clinic. So we
Okay.
see everything. The good thing is that I can design my practice to what I like, to
Okay.
how I see patients. So
Okay. Okay. Very good. Um, hmm. What would you say? In fact, I can think of someone right now. He's MS patient in terrible
mhm.
pain. Nothing works according to
Yeah.
him.
Hmm.
Um, and it really seems as if he's given up hope.
Yeah.
What would you say to someone like that?
They're tough. Those cases are very tough, especially if they've tried everything that modern medicine has to offer. You know, for those patients, may even, I don't even know if they've gone down the route of trying the IV ketamine, because that's something that has been shown to help.
Right.
So, reverting and doing some things outside the box may
Mm-hmm,
help.
mm-hmm,
If they have an MS, is basically a disease of the neurologic system. So
mm-hmm,
PRP treatment may not necessarily work, but for somebody with like chronic, joint pain that they can't find anything wrong.
mm-hmm.
Say PRP may be an option, but for someone like him, because it's so systemic and it's central, um, you know, talking about some of those IV infusions, or at
Okay.
least introducing that may help. For someone like that, it will be really hard to. It's possible. It's definitely possible, but it will be really hard to work with them from a psychological aspect and trying to get their pain controlled,
Mm-hmm,
from their perspective and how they manage the pain and how they view the pain, because
mm-hmm.
every experience that we have in life is viewed through our lens, and we
Yes.
get to choose how we interpret or how we see things.
Right.
So for an MS patient who's been, and most of the time they've had the MS for a long time,
Right.
they can manage their pain if they're able to reframe
Right.
how they view their pain.
Right.
And there's also two nutraceuticals that can be considered, diet changes that can be considered.
Mm-hmm.
There's the Walls protocol. Sometimes my patients with MS, I talk to them about that. It's basically removing certain foods that have been shown to um, exacerbate the symptoms of MS.
Mm-hmm.
And so Dr. Walls, she herself had MS and she created this program. So sometimes I share that with them.
Okay. Okay. That sounds good. That sounds very good. Okay. And your clinic, if they wanted to reach you, what is that called? I'm sorry.
It's SIMED, SI, it's all capital letters because it stands for something. So it's S, capital IMED, all capitalized, Health Clinic.
Okay.
And
Okay. And they can reach you. And your coaching now is Better Health
life
Coaching.
coaching, yeah. Yeah.
Better Health
You
Life
can say,
Coaching.
I prefer to call it as life coaching because health coaching, health incorporates, like, to me, people think of health as just like, hey, I want to feel better. But when I do my coaching, it's like I target all aspects of life.
Okay. Very good. Very
So it's
good. That's
not,
important.
yeah, it is, but yeah, because I mean, we're not just the body.
Right.
We're more
Hmm.
than that. We're spirit. We're a soul. We have a
Hmm.
brain. Um,
Yes.
so we have to address all aspects of the body or the
Very
person that
true.
we are.
Very, very true.
Yeah.
Wow. Wow, this has been good. I know I passed over that topic of genetics. I did get a book,
Hmm.
which didn't deal with all the, you know,
Hmm.
chemistry, biochemistry. It just explained epigenetics, which
Uh-huh.
I also think is very fascinating.
Hmm.
There were examples in the book how people who were let's say during the Great Depression,
Hmm.
they there's a lot of famine going on, and how their offspring and even grandchildren suffered from obesity because they had the genetic changes
Hmm.
that came from their ancestry,
Yeah.
to where they felt if you have food, you better eat because you don't know when you're eating again. But unfortunately, that being carried down when there's no problem with the amount of food that
Right.
you have. So very interesting things. Just wondering on your take on that. I do.
Hmm.
I've heard TD Jakes say this is because you talked about us being more than one, we're not just our bodies. As African Americans, African people of the African diaspora,
Yeah.
that we are a broken people, you know, and there's things trauma that has come down through generations that has affected our bodies, that has affected our spirits, our minds, and how to address that. I know we're going to existential here. I just figure we have some more time, so why not?
Yeah. I mean, it's a very interesting question. It's something that I do take into mind, and I take it seriously. I do believe in epigenetics because the data is there that shows that there are changes. And you're right. When you have, a mom who's pregnant, with her child, and she doesn't have food, she's going to want to, whatever food that she eats, she's going to want to store it for later use, and the body kind of slows down the metabolism and just stores everything for further use. And usually the best way to store it is fat, right? Mm-hmm. So you pass on that modification in the genes when it comes to storage of energy, and it's passed down, right? Mm-hmm. What I believe in, granted, yes, there's been a lot of trauma, to say the least. Mm-hmm. In the African diaspora. I'm originally from St. Croix, and with parents from Antigua, and I know and have read about all the atrocities that were done to the slaves. Mm-hmm. However, I always keep in mind that as adults, we get to choose mm-hmm. what belief systems we are going to keep mm-hmm. versus which ones we are going to discard mm-hmm. and which ones that we're going to basically take up or start adapting. Okay. Mm-hmm. And that breaks down to how we handle our bodies, what we do to our bodies. So, for our population, for our people, we love our food. We love our food, well seasoned. But if you know that you suffer from hypertension, mm-hmm. right? High blood pressure, your pressure is high. You know that you need to change your diet. If you know that you are prone to diabetes because it's very strong in the family, mm-hmm. you can change. You can decide, hey, listen, I'm no longer going to eat all of these like sweet desserts that, mm-hmm. You were so used to eating, and these, mm-hmm. Pastries, candies, and the stuff. I mean, like even in the Caribbean, it's like, oof. I mean, our food, the way we eat, mm-hmm. It's not healthy per se. Right. There are aspects of it that are healthy, definitely, but right. there's some aspects that are not. Mm-hmm. So we get to choose as adults how we treat our bodies. We can't do anything about the trauma that occurred. So we can't necessarily keep blaming that trauma for mm-hmm. everything that goes on. Oh, it's because, this person did that, or this person did that,
Right. I agree with that. Yeah.
Mm-hmm. And healing, I always start when I work with my clients, healing starts from beginning to love yourself first. Self-love. Mm-hmm. Okay. So that's really important for us to recognize and for us to do.
Right. Awesome. I agree. And forgiveness, because that's part of loving yourself. These people hang. I always tell my patients, why are you letting that person take free rent in your brains?
Yes. Yes. You put the blame on other people, right? Oh, the person did this. No, they didn't. You did it. It was your action.
Yeah, just let it go for your sake. Yeah. Let it go.
Yeah.
Okay, well, thank you so much. We have a little more time, but if someone worked with you as a coach, mm-hmm. If that would be something ongoing, it would be it's obviously not an insurance-based thing.
No, it's not insurance-based because I spend time. So, mm-hmm. Where the sessions are typically an hour long, and, there's what I'm finding is that I cannot give a specific time frame and say, okay, we're going to deal with all the issues and get to you, because it's basically, I put people into action. It's all about putting people into action, mm-hmm. because they know what they want. They're here, but they want to get over here. And it's that space in between that's the struggle. So I'm there to help them put them into action so that way they can move from whatever point in their lives that they want to move from to go forward.
Okay.
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 So what I find is that it depends. Everybody's different. You know, some people get it quickly. I have had clients who, you know, they're 100% into it. They do the I call it life work that I give them. They do it, and other people, like, I try to get through, you know, try to help them to reach or at least achieve the goals that they told me that they want to achieve, and they say at some point they were like, no, I don't really want to do this anymore, and that's fine.
Right. Right.
So yeah, it really depends on the person. I just would say, you know, be honest with yourself, and when you, if you're ready, you know, you don't have to necessarily work with me because, as you said, you know, we have millions of people on the planet, billions of people actually,
Right.
and there's no way that we can work with everybody, but we have our set of people that will gravitate towards us.
Right.
And so what I always tell people, if you want to work with me, be ready to hear the truth, or at least I will get you to understand your truth and doing work, because it doesn't make sense for me to just talk with you. I want to put
Right.
you into action, and so
Right.
that's basically what I do. So the
Right.
sessions, number of sessions, all depends on the person.
Okay. Okay. Very good. Well, once again, Dr. Janice Brown, thank you so much. I think this has been really informative. Anyone that would like to work with her or keep in touch with her, you can go to www.betterhealthlifecoaching.com. And anyone in Florida, please reach out. All right. Until next time, peace and blessings.
Thank you.